It is just a huge honor for me today to be podcast interviewing Dr. Dan Holtzclaw, DDS-MS. He's a board certified by both the American Board of Periodontology and the International Congress of Oral Implantologists. He has published over 50 peer-reviewed journal articles, textbook chapters, and books. As a matter of fact, Dr. Holtzclaw recently authored the very first textbook ever published on pterygoid dental implants. Over the past decade, he has provided 100+ lectures in a dozen different countries and has been honored as a leader in continuing dental education by Dentistry Today magazine for the last 15 years. He served as the editor-in-chief of the Journal of Implant and Advanced Clinical Dentistry for 12 years and as an editorial board member reviewer for multiple other dental journals, including the Journal of Cosmetic Dentistry, the Journal of Periodontology, and Compendium. He is a past recipient of the Excellence in Research Award from the International College of Dentists and is one of only 10 clinicians recognized by the American Academy of Periodontology as an officially recommended speaker for craniofacial reconstructive surgery. He is a native Texan raised in the tiny town of Humble, Texas. After attending Texas A&M University, he graduated with honors from the University of Texas Health Science Center, San Antonio, and was commissioned as an officer in the United States Navy. While in the Navy, he attained the rank of lieutenant commander during 12 years of active duty service. During this time, he completed a 1-year hospital general practice residency at Naval Research Center at Portsmouth, Virginia, and an additional 3-year residency in Perio at the National Naval Medical Center, which is the President's Hospital in Bethesda, Maryland. He was awarded nearly a dozen service medals and finished his naval career as the periodontist for the world-famous U.S. Navy Blue Angels flight demonstration team. My God, what a legendary bio. I mean, what the hell could you do for an encore? And what did you do for an encore? You recently just published a book, and we just posted that on Dental Town. My gosh, writing a book, that's like making a child. It takes 9 months to make it. I mean, that's a lot of work. How did that journey go for you?
Well, what's interesting is a lot of it ended up having to do with COVID. When I started basically writing a couple of articles on just various aspects of pterygoid implants towards the end of last year. And, then COVID came around and, all our practices had to shut down. So we're sitting around doing nothing. And I said, if I string a couple of these articles together, I could probably expand on it and, turn it into a textbook. And at first I thought, okay, I could probably get this, be like, 125 pages and, be just a, small, textbook. And then before I knew it, it ended up coming out to 230 pages. And, we had it finished by the end of the summer and came out in September, but, certainly wouldn't be able to do all that if it didn't have, the downtime from COVID. So that really was the impetus to get it going and get it published, is just all that free time.
Well, I mean, it's an amazing book, and on Dental Town, people are saying great things about it. Unfortunately, a quarter of our listeners are still in dental kindergarten school, so the title of your book, they might not even know what the hell you're talking about, Pterygoid. So start off for the homies that are still in dental kindergarten school and tell them what that is and what the book's about.
Well, to be honest, I mean, a lot of dentists, period, don't know about the pterygoid, and even specialists, because unless you're an oral surgeon, you're typically not going to be anywhere near the pterygoid complex at all. And what the pterygoid is, it's really a combination of different bones, basically at the very back distal aspect of the maxilla. If you essentially go behind the tuberosity, behind the sinus, you've got the tuberosity, and then you've got the pyramidal process of the palatine bone, and then you got the pterygoid, lateral and medial pterygoid plates of the sphenoid bone. And essentially, those bones are what you're aiming for in anchoring this particular implant. And so it's way, way back in the mouth. And, unless you have a reason to be back there, you typically won't ever be back there.
Yeah, and on Dental Town, Pav, Kiara, BDS from London, says he loves your book. I love your website. You can buy the book on Amazon, but you can buy it also. It's far more informative if you go to a site, Pterygoid Implant Book, Pterygoid, Pterygoid Implant Book. But you have some really neat diagrams in there. But walk them through. What I always found interesting about the all-on-4 and Pterygoid implants is how the angle, instead of just placing it straight, the implant straight up, you like those angles. And talk about the importance of angulated implants for what you do.
Well, with the standard, all-on-4 type of treatment, some of the reasons the angles came about was, really for anatomy. You're in the maxilla, you're angling to avoid the sinus. You're also getting, a longer implant end that's able to anchor into more bone. It's also allowing the AP spread to be increased. So it has, a various number of reasons why you angle them. And then the mandible, the same type of thing. You're, avoiding the inferior alveolar nerve, the anterior loop, of the nerve at the mental foramen. And so, by angling it, it's giving you all those benefits. And then with some of these other implants, I like to call them exotics, like the Pterygoid and the Zygomatics, just from the nature of the anatomy of those structures, with the Pterygoid implant, not only are you having an angle, in a distal direction, you're also having an angle in a medial direction, basically towards the middle of the head. So you're angling actually in two different planes, which is, quite a bit different than what you do, say, with the standard all-on-4 treatment. And then on the Zygomatic implants, you're using a significantly longer implant, but you're having to angle, essentially up to the zygoma. And that's going to, all be anatomically driven. And what's interesting is, when you place these implants, because they all are anatomically driven, even if you're doing them freehand, by the time you finish and you look at everything on a CAT scan, most everything ends up being parallel because, to each other, because that's how the anatomy is. And, so you're following those bones essentially.
So the P is silent. It's pterygoid, correct?
Yeah.
Pterygoid. So, all-on-4, do you agree that Malo started that revolution? I mean, would you historically say that?
Yes. Oh, definitely. Yes. Starting the revolution for sure. I mean, he, historically has the first article published on this in 2003. And, these were, based on implants that, were actually placed in, 98. And, certainly he pioneered the, getting this out to, the dental community, did a lot of research. He still continues to do a lot of research, publish a lot. And I would certainly say he's, the probably biggest reason that this treatment is as commonly accepted as it is within the dental industry today, for sure.
So that he kind of created this buzzword all-on-4. So is pterygoid implant, how was that different than how is what your first textbook on pterygoid implants ever different than an all-on-4? What's the differences there?
So essentially, now it's commonly called the buzzword is all on X, because all on 4 was basically a trademark from Noble Biocare. They were one of the first companies that really pioneered and pushed this product onto the marketplace. And since then, many other implant companies have included this type of treatment into their repertoire. And many clinicians over the years, as they're doing this, would place more than 4 implants, sometimes 5, sometimes 6. So now the common term is just all on X. Where pterygoids came about for me basically out of necessity. When you start doing lots and lots of these all on 4 teeth in a day kind of procedures, you start seeing a lot of different scenarios where the bone is soft, or the sinuses have really expanded and become pneumatized. And, when that happens, it limits your AP spread. And so, I needed, some areas of denser bone. I needed some areas to increase AP spread. I wanted to eliminate cantilevers. And really the only place to do that is either zygoma or the pterygoid. And, pterygoid implants were actually, started back in the 70s, back when subperiosteals were used. And with Linkow, and Hahn, they were looking for a way for better support on these subperiosteals, and the bone in the posterior maxilla is, just extremely soft. But there's this very dense, hard type 1 bone way back at the hamular notch, at the pyramidal process. And by using that bone, even way back in the 70s, they were able to get better anchorage. And so basically in the late 80s, throughout the 90s, there was some use of the pterygoid for regular root form implants. And all of these studies, from some pioneers like Balshi, they were utilizing this. And it was still just a very niche, product, because even back in the 90s, there really wasn't a lot of all-on-4 immediate loads being done. But as the 2000s have gone past, now the 2000 teens have gone past, all-on-4 is a very commonly accepted protocol. And as we're doing more and more of these cases and finding more needs for different patients that have different, anatomical situations, we've begun using these areas such as the pterygoid and the zygoma, much more commonly. And as we keep publishing articles and textbooks on them, I think the use for these different areas of bone will continue, and it's really opened a treatment to a whole other realm of patients that before, have been told that they couldn't have any treatment before. But now with some of these other areas available to us with dense bone, we could, treat these patients where we couldn't in the past.
I just want to shout out to Jack Krauser. He wrote the foreword to your book. He's I love that guy. I've known him for years. On Amazon, it only has 5-star reviews. Pterygoid implants, the art and science. My gosh. And it was published. Amazon's got the date September 11, 9/11. 2020. So I like to see good things on 9/11. My son was born on 9/11, and on that other 9/11,
Oh, wow.
I'll never forget. 2 days later, he comes up to me crying and says, "Daddy, are we ever going to celebrate my birthday?" And I thought, "Oh my God, I completely lost it." But it says it says in the book, although they have been in use for over 50 years, pterygoid dental implants are one of the least understood styles of dental implant treatment. This may be due to the fact that pterygoid implants are widely considered to be one of the most difficult fixtures to place in all of implant dentistry. In this 230-page textbook, Dr. Dan Holtzclaw details his experience utilizing pterygoid implants in hundreds of full arch immediate loaded cases. But what's actually better is his website, Pterygoid Implant Book. All kinds of just amazing pictures and photos and et cetera, et cetera. And you're coming out to the desert, out where I live. You have an interactive 4-day live patient workshop, immediate implant placement of severely atrophic cases, presented by none other local homegrown hero, Vichy Broman, DMD, MD, and yourself, and Dr. Mike Thom. And that's going to be at the JW Marriott Desert Ridge Oral Surgery Institute right here in Phoenix on February 25th and 28th. My God, that's not very long from here. You also work with my buddy Justin Moody.
Yeah, at Implant Pathways, we're going to be actually filming some surgeries out there in a few weeks. And then also through my new role with affordable care, we do a lot of training with, Implant Pathways. So we'll be out there for half the week doing a lot of training with affordable doctors. And then the second half of the week, we'll be doing the Zygomatic and Pterygoid training with Dr. Broman.
Well, you just made a big move. You went to affordable, and I love affordable. That's that was a big decision. I always thought dentistry it was just too focused on the elites. It kind of reminds me of the auto industry before Henry Ford. Before Henry Ford, there were 86 different car companies, but there's always 5 guys making one really expensive car for a king. And I remember when I went to the Pankey Institute when I got out of school, and the first day of lecturing was talking about how there were A patients, B patients, C patients, D patients, and F patients. You need to focus on the A. And I realized my entire pedigree from Kansas were all D and F patients. I mean, we're all a bunch of trailer trash. And you go to these courses and they show you these all on 4s, but there's no courses for all on nones. And so, you call them all on X, which is much better. But how many full dentures are done, do you think, for any all on X?
How many dentures are done? Oh, well,
how many all on zeros versus all on X?
Probably a lot. I can tell you that, the Affordable Denture Network, has been in existence since, 1975. So they've been around for a long time. And of course, they, specialize in dentures and, have expanded to other tooth replacement solutions such as, implant supported dentures and more recently fixed solutions. But in terms of dentures, for example, last year in their network alone, just for affordable dentures, they did close to 750,000 dentures. So there's definitely still a lot of dentures being made, out there. Everything's not
so that
implants.
number. So that was in 2020. They did 700. What'd you say? 750,000 dentures.
Yeah, it's amazing.
Yeah, and then how many all on anything cases do you think they did in that same time period?
Well, in the fix, certainly less than that. It's something that the company, hasn't really focused on in the past, and that's one of the reasons that they've brought me on board is to expand the essentially tooth replacement solutions that are being offered by the company. And as you mentioned before, the name says it all: affordable dentures and implants, and their sister company that they own is now Denture Dental Implant Solutions. They do specialize in bringing this type of treatment at an affordable price, which opens this market up to a whole cohort of patients that traditionally have not been able to get this type of treatment. And that's really what the company is looking to do, is to make this affordable and accessible to a lot of people that in the past really haven't had an opportunity to get this type of treatment.
Yeah, I've seen when I went through the Mission Institute. This is way back. This was so long ago, and when I went there, the Dead Sea was just barely sick. When I got my fellowship at the Mission Institute, I remember that the people, now 30 years later, looking at who did the best with it, was they went back home and they bought the little denture world in Bakersfield or South Carolina or whatever, which had a great brand name for 20, 30, 40 years, a low-cost place to do a denture reline. You don't have to leave your teeth. They had the lab man, and they would get all their diplomat implant stuff, and then they go back there and just offer an upgrade, like, well, maybe just 2, or maybe, whatever. And so they start off with the typical advertise a low price, then try to upgrade. I mean, they do it at McDonald's. You order a Big Mac, and they say, do you want fries? And I've never said no. And so they say, okay, well, we have these, the one advertised for $250's got these low-cost teeth, but Ivoclar's got some really expensive blue teeth or whatever. That's more. And on that lower, for $1,000 more, we could put an implant or 2 down there. I noticed in Australia, they're big into putting one right in the middle, where Americans, it's only 2 where the canines were, but they just have a series of upgrades all the way to the $25,000 an arch all on 4. And they'd sit there and tell you that, you can make 90% of your customers happy with all this low-cost stuff, but that's the mining ground for your upgrades. And the only dentist I went through the Mission Institute that now do $3 or $4 or $5 million a year and just clean house. I don't want to say any names because it might get back to like Chip Castine in Bakersfield, Florida. But my gosh, that was their strategy. aim for the low cost, all on zero, and then upgrade from there. And the bigger your base of all on zeros gets, the more implants you're doing. Do you like all on zeros?
Well, I mean, my practice, historically, we were, we were all just fixed, so we didn't even do implant supported dentures. Every patient that, we were a direct to public clinic, and we didn't have any referrals, so basically everybody that came to our clinic, is typically from, TV commercials or internet advertising, was coming for, fixed arch type of treatment. And so, as time went on, we even got more highly specialized, and we were targeting the patients that, had been told, there was nothing that could be done for them. So we were doing, much more zygomatic cases and pterygoid cases, because that's the patients that we were particularly seeking and targeting with our advertising. So historically in my private practice, we didn't do any of those other treatments, not because we didn't want to, it's just we weren't set up for that. We were just basically set up for fixed treatment. And that's certainly different with affordable. They are offering all gamuts of treatment from just a traditional denture to an implant supported dentures to even partials, all the way up to fixed. And like you said, there's different price points on that, and so it really opens it up to no matter what your income level is, whatever your comfortable affordability is, that there's at least some option for you, from A to Z. And, that's how I ended up coming to become a part of the company, is they just had that commitment to want to be able to help, really anybody that walks through the door, no matter what their income level or what their need was.
I noticed your event, which I'm so excited about it. It's right here in Phoenix, our backyard. The link to that basically comes from an event from the norrismedical.com. So Norris Medical is a leading dental implants manufacturer. So are you implant agnostic, or do you like Norris Medical for other reasons more, or can you talk about that, or are they just better in pterygoid implants?
Well, of course, over the years, I've, had the pleasure of working with, a number of different implant companies, for, MIS and Noble Biocare and Neodent and Norris and, and now with my new role in affordable, also getting to work with other companies such as BioHorizons. And, so, because we utilize, a number of different brands, I've, had the opportunity to work with, a number of different companies, and, each brand definitely has, their strong points. And, one of the great things with Norris is they, have a very specialized pterygoid line, and their pterygoid implants are specifically designed for the pterygoid. They have a zygomatic implant that has a highly specialized design specifically for zygomatic treatment. And they also have, standard implants for regular implant treatment. And I've had, excellent success with the Norris line of dental implants. But I've also been, very happy with, all other implant systems. I'm currently also working with Neodent, and I've had, good success with them. Have BioHorizons, very good success with them. But yes, this particular program is put on and sponsored by Norris, and they've always done an excellent job in their training programs. I've done a number of cadaver courses with them. This will be a live patient surgery course, and they just do an excellent job on their training courses, and then also, their follow-up support with their implants. And you usually get a very nice deal on the implant packages when you go to the course, so that's always a plus as well.
You know what I really loved about affordable? What I love about affordable, I mean, I posted this yesterday. There's not a lot of love. It doesn't really get that much expressed for the poor. Like even in the stock market, I published this. Let me get to it. Yeah, like the Federal Reserve in St. Louis, who holds the wealth. They're showing that total assets held by the top 1% is basically a third of the stock market. And then the next 9%, top 10%, gets you all the way to 71% of the market. And the bottom half does not own 1%, not of the market. We're talking about of wealth, just of wealth. And this is from economic data from the Board of Governors. This one is from the Fed St. Louis side. But so half the people in America don't even have 1% of the wealth. And so there's going to be a gazillion more dentures for every $25,000 narch all on four. And there's also more money in that half. Like, would you rather own McDonald's or would you rather own Ruth's Chris? I love Ruth's Chris, but I love McDonald's more and more often. And there's just a hell of a lot of money in treating the middle class and the poor and trying to make it affordable. And I went, and you know what I thought was the most genius about affordable, though? I mean, that company is a gazillion years old. But when that company started, their marketing was they would go into each town and they would do a fee survey and find out what's everybody charging for just a simple routine extraction. And it was always $100. And this was when they opened back in 1975 in Kinston, North Carolina, when founding dentist Dr. George Edwards Jr. and Donald Henson. But anyway, what they would do, they say, okay, everybody's lowest fee for a routine extraction is like $146, not even counting like the PA, the bite wing exam, just the extraction. Because if they called your office and said, how much is it for a routine simple extraction? And you say 145 or whatever. And they would run an ad, and their only ad would be tooth extractions, $99, affordable denture. And what these geniuses knew is, who the hell needs a tooth extracted? I don't need a tooth extracted. Do you need a tooth extracted? The person that needs a tooth extracted is probably a blowout disaster. They probably need lots of teeth extracted, root planing, curettage, partials, dentures, implants. And that was their genius way of just going into a haystack and pulling the needle right out of it. And then another guy from that implant, back to the Mrs. days that went back, he did the same thing with implants. He was in a high ritzy area in South Florida where you're at now, and he's only done one ad for his whole career. In fact, his wife was telling me about it. We were lecturing together in Australia one time, and it's just dental implant, $9.99. He says everybody's 1,000 something, and then they nickel and dime from there, bone grab, blah, 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 blah. And he just has had one ad. It's the size of a dollar bill. It says dental implant, $999. And he says it's just like a cash cow machine. So what made you decide, with your legendary background, to sell your office to Affordable and then become their director of fixed charge services for Affordable Care, which also does business as Affordable Dentures and Dental Implants and Dentures and Dental Implant Services? But what made you do that?
Well, to be honest, when, in your career, you have certain goals and milestones that you want to accomplish. And, when I had done, all on 4 type of treatments, then I, moved up to doing, pterygoids. And then I checked, pterygoid off my list. And then I, wanted to do a zygos. And then I, did zygos and checked that off my list. And then, then did quad zygos and, quad zygo pterygoids. And, I finally got to a point where I felt that I had done at least in the fixed arch realm of implant dentistry, that I have, done every possible thing that there was to do, and that, there really wasn't anything else to accomplish. And, then I had opened a second practice because we wanted to see, well, if what we're doing here, can it work elsewhere? So we had opened a second practice and that worked. So we felt that, with what we have, we accomplished all the goals that, wanted to accomplish. And now we wanted to basically take this, and spread it to more people. And certainly trying to do that on your own is an incredibly difficult task. And, the listeners on your show, there's certainly a number of our, dental, brothers and sisters that, have multiple offices and have, grown them. And that's not a very easy thing to do. And for, what we wanted to do to get, fixed arch treatment to more of the population, doing that on our own would be, almost impossible. And really an entire lifetime of work, we'd still only reach a small percentage of people. And, through going with affordable and, for a lot of the, things that you discussed previously, they already have 350 clinics in 40 plus states. They do treatment at a cost that does make this affordable to many more people that could normally attain it. And so I felt, this is really a way that we can spread this type of treatment to, just thousands and thousands of people all across the country and really help a lot more people working with this network than I could ever do on my own. And, that was, the, big impetus behind working with them. And I've been with them now for about going on 4 months or so. And, so I'm still getting to meet a lot of the doctors in the network, and they're great. And, I'm very excited about the opportunity to help bring this type of treatment to a lot more people, throughout the country.
And now you sold them your Austin office, right? Which was Austin Dental Implant Center. So does that allow you to just be focus on a dual board certified periodontist, and now you don't have to do as much administration work running the business of the practice? Was that a factor, or did you notice that?
Well, with my role now, I'm primarily educating the other doctors. There's 500 plus doctors in the affordable network. So, that's certainly a lot of work to work with, that number of doctors, helping to implement this entire, system of treatment throughout the network. So it's a lot more than just simply teaching the surgery. It's, teaching, literally all aspects of everything. And so that is really my full-time job. And I still, one thing I made clear before I came to the company was that I still wanted to do surgery. I think having a director of, surgical services or director of, fixed arch services, but you're not doing any surgery anymore, that doesn't really hold water in my book. And so, I still am able to do surgery. I just don't do as much surgery as I used to because I'm, busy doing a lot of, other things to help, get the doctors in the network, trained and prepared. And, so that has me traveling quite a bit, which is hence why I'm talking to you from the car on the side of the road.
You also have you've published a lot over the years of the amnion, amnion products that have begun to gain acceptance in the dental industry, with placental products hitting the market. You're one of the first dentists using and writing about these products, introduced by Synosis back in 2008, and you published articles on that. Will you talk about that and what that means to you?
Yeah, actually, so I had a long histories, with placental tissue. My wife, when we had our first child, which was actually back in dental school, my wife had preeclampsia. And, that's a condition where your blood pressure can, skyrocket, during parts of the pregnancy. And so, I was quite familiar with a lot of, pregnancy issues. And then when I went through periodontal residency, as part of our, master's thesis, we have to do a, research project. And so I did, looking at periodontal disease and links to preeclampsia. And so I was doing a lot of blood work looking at interferon gamma and interleukin 12, and basically knew more about placentas than probably any dentist on the planet. So that's what I ended up winning that research award for the International College of Dentists. But later, in my career, when I saw there was a placental membrane product that was being released on the market by Snoasis, I was very interested in it because I had this background in working with placentas. And so I was one of the first users of the product. And when that product first came out, it was a material called BioExclude. It was originally just used for soft tissue augmentation. And a couple of dentists, such as myself and Paul Rosen, who's a periodontist in Pennsylvania, product for other applications. And at that time, nobody had ever used it for that. We used it for guided tissue regeneration, and then extraction site preservation, and then sinus lifts, and then you name it. We've used it for a whole variety of applications. And now we fast forward a decade plus later, now there's multiple companies that are selling amnion chorion products. But from where it started from, its humble beginnings was just used for soft tissue augmentation. And that's what's great about publishing research and and using this in private practice, and being able to document it and show your colleagues some other applications of this is now it's being used for dozens of applications. And with Snoasis Medical, I've published I don't know, at least a dozen plus articles on various applications of it, even nerve repair. And what's great about the placenta is it's it has 240 plus growth factors, chemokines, cytokines that are naturally in the material. I mean, this is where life starts, in the womb with the placenta. And so it just has a number of natural properties that are really amazing for healing. And its use in the medical industry, they're using it for treatment of non-healing diabetic ulcers and prostate surgery, a whole explosion of applications. This product, the placenta has been used, one of the first studies published on it was in 1910. So it's been around for a long time, but just with some of the newer processing technologies, it's really exploded in use, in the past decade. And so it's a pretty exciting time for this type of product.
So a lot of people are just triggered by the word placenta. I mean, they automatically, there's a lot of the anti-vaxxers I know, like my oldest two sisters are Catholic nuns. So there's a lot of anti-vaxxer people just because they believe that it's related to something like that. But explain what placenta tissue, does it involve, the unborn babies or anything like that?
No, so all these placental tissues, they're all from basically C-sections. Of course, it's from consenting mothers. Just like if you're donating, any other type of tissue, it's basically all from consenting mothers that are having C-sections done. And so where Snoasis Medical processes their materials from a company called Mimetics, which is out of Georgia. And they're actually a NASDAQ traded listed company. And the majority of the product is used actually for medical applications, but with Snoasis Medical, they distribute and produce a BioExclude, which is the dental application of this material.
The only other person I have heard talk about this, like you, is another board certified periodontist, Tyler Borg in Denver. Do you know Tyler?
I don't, but there's definitely there's definitely a lot more people using this nowadays, just because it's now that we've published all the studies and have shown the different applications, it's always hard being the first ones doing a lot of these things because you don't have the, literature behind it. And certainly now that we've, published, many, many articles on using this material and also, the science behind it, that's why I think you're seeing a lot more widespread application of this and use of this and acceptance among dentists in the dental industry.
The American Association of Endodontists, they realize that root canal has got a bad, that triggers a lot of bad stuff out of everyone. They were trying to change root canal to endodontic therapy. The occlusion people are always trying to say, well, TMJ is just a joint. It's TMD, the disease. And it doesn't matter what it's, the market has spoken. Do you think the market is going to brand teeth in a day, all on four? What do you think brand is going to stick with them?
Yeah, well, literally every company has come up with their own term for it. And I can tell you that patients don't know the name of it when they come in. I've heard them, call it 10 different things. And most of when they call it, they're still not even using the correct name. They basically want, implant teeth that don't have to come out of the mouth. And, that's the gist of what they're looking for, whether, it goes by one name or another. And, they know the idea of what they want, but, they don't necessarily know the name of what it's called every time.
Yeah. And then also there's a lot of dentists who complain, or it stresses them that, the person that needs, it's kind of like the health history for a dental implant. They say, well, you can't do it on smokers and obese and overweight and all that. Well, the people needing implants are usually not your vegan yoga instructors. They're usually your drinking hillbillies out in Apache Junction that smoke and Smirnoff and the whole 9 yards. And so, they had no home care to begin with. That's why they're in full dentures. And when you do an all-on-4 fixed, when you see them 6 months later, there's a entire ham sandwich underneath the implant. If it was removable, they could clean it so much easier, but they don't want removable. They want it fixed. How do you wrestle that in your mind?
Well, if these are, designed properly, you typically don't get tons of debris under there, although certainly you get tissue changes with time, so you can always have that happen. But, what really has to be stressed to the patients when they're having this type of work done is just like your car needs an oil change. If you don't ever change your oil, your engine's going to burn up and your car's not going to work. If you're having this done, you still have to have maintenance done. So it is very important for the patients to come in, for a yearly maintenance with these. When they come in for yearly maintenance, we remove the teeth, clean them, retorque all the parts and pieces, replace the screws. And, and what you'll find is that, this is a big investment for people, short of their, house or their car or their, children's college education. This might be one of the biggest investments that they do make in their lifetime. And so what you'll find is even when people may not have taken care of what they got for free from nature, when they're having to actually pay for this, that, they typically do take much better care of it. And plus, their warranty is also tied to them coming into these maintenance appointments. And if they don't come in for maintenance, their warranty gets voided. And so you'll find for the majority of these patients undergoing the procedure that they will do much better care with these teeth. Certainly you have some that, didn't take care of their natural teeth and, they don't take care of these. But the other difference is, when you take all of the teeth out of the mouth, the bacteria profile of the mouth also changes to where, when you had a history of periodontal disease and you had more red complex bacteria and orange complex bacteria, these bad, actors. Once all the teeth are taken out of the mouth, the bacteria profile in the mouth also changes. And so, you take all those into consideration and, the teeth, will last, but they still have to come in for their maintenance visits. If they never come in, they certainly can, develop problems just like they did with their natural teeth.
You know, and by the way, you have a master's degree in oral biology. So what he just said, that wasn't. I mean, he has a master's degree in oral biology from George Washington University. I mean, that's very impressive. Dentists really get focused when they have to spend a lot of money, and if they see peri-implantitis, a lot of them are wondering, from guys like you, do they need to invest $135,000 into a millennial dental laser? You know, they have they started with LaNav for peri-implantitis, and now they have LaPip for dental implants. Or do you think that's a good, wise investment? That's a lot of money for a lot of people.
Well, I guess the short answer to that is I've never owned one, so that may answer that.
Yeah. And then the other thing is I want to say is that it seems like the rich people always figure out how to fix a problem faster, easier, higher quality, lower cost, smaller. And like some dentists, they would have learned something about occlusion and they fly halfway across the country. And I'm like, dude, you could have learned that on a $36 online course. You didn't need to fly 3,000 miles to go there. Now, on your 4-day courses, are those going to be surgeries there? Will there be live surgeries?
Yeah, so the one in Arizona is live surgery because in Arizona you can get a temporary license, and so for that particular course, the course participants do have to apply and get a temporary license. But yes, they are actually treating patients with their own hands at that course. You don't have to. In the past, you'd have to travel to a foreign country and have the expense of going there, and then also during COVID, obviously that's not the highest thing on people's priority lists. But now with a handful of states in the U.S., you can get a short-term temporary license, and so there are some training programs that you're starting to see in these areas because you can get hands-on work at those training courses.
And I got a shout out to that to Chris Volchek, DDS, who's a dentist from Globe, Arizona, and he has been working at the homeless shelter. And it was he went to the board and he said, "Look, I got vets that stand in line for 100 yards to get these free surgeries, and they can't because the dental board, that they don't have a license. So I want you to tell me your name and who will not allow these temporary licenses so that American vets getting free dentistry done by dentists who have traveled here from other states." And the board was just laughing. They're like, "Yeah, well, we obviously can't say that." So that's how the whole program got passed. That's what the Supreme Court does. There's 1 million cases a year, but they cherry pick those 100 cases to where it gets very focused. And Chris Volchek could not get the Arizona board to say, "No, we're not going to give a temporary license to a dentist who paid his own money to fly here to do voluntary dentistry on vets." So shout out to Chris Volchek. Good job for that. My God, I can't believe I got the mission pulled over on the side of the road on the way to an airport to fly home. Anything that we should talk about that you thought we were going to talk about that we didn't?
No, I think we covered just about everything.
Yeah, and I like your frankness. I mean, a lot of people don't want to say, they don't want to not recommend a product, especially a big product like that. They don't want to hurt the industry or something like that. But you've been very upfront, very forthright. I love Bob Fontana's mission to go where they're not at Aspen. I mean, they're going to where the Medicaid patients are, and the dentists all want to be in North Scottsdale and Beverly Hills and Manhattan. They all want to treat lifestyles of the rich and famous. And the people that go after the half of America that doesn't own any wealth, my God, it's a huge market. There's so much less competition there. I mean, obviously, here's a typical Arizona dentist. I know them. They wake up in the morning, and there's one dentist for every 2,000 people. They commute an hour to work downtown, and by the time they get out, there's one dentist for every 500. But if they would have commuted the other way and gone an hour out of town, they could have gone to Eloy that has no dentist for 6,000 people. The Pew Research has done the demographics. They show you the 11% of the counties that don't have a dentist, the underserviced. But I just want to say that, instead of just thinking veneers and Botox and boob jobs and tummy tucks, get into all on 0 and then learn how to do an all on 1 and then 2 and then 3. And you're not going to start doing all on 4s and pterygoids like Dan the man here. He's a couple decades down the road from where you are in dental kindergarten school. But man, Dan, if you did it, do you think what % of the class in dental school could do it?
Well, I think what you said is actually very important because, I definitely see that trend a lot in dentistry where, people want to go from step, A to, J instantly without going to B to C to D. And, I think that's very like what you just said, all on 0 to all on 2 to all on 4 to, that's a very good progression. And, it's very important for dentists to not get ahead of themselves, and I think everybody, really knows themselves what they're capable of and what they're not capable of. And, that's very important to, before you get to that next step, to make sure that you're very comfortable with where you're at right now, because one thing that you have to consider is when you start doing these types of procedures, you always have to plan, can you handle the complications that are going to come with the procedures? And, that's one thing that we see a lot in dentistry is, a lot of people, will take a course for something and then immediately start doing it and doing more complex cases. And everything is great when everything works fine. It's when things don't work fine, do you have the ability to make things better and fix those situations? And so when people embark on doing some of these more difficult type of treatments, I think that's the thing that they always have to keep in mind is that if this, has a problem, and they all will at some point, every case will, or every type of treatment will at some point, if you do enough of them, is, are you going to be ready to handle those situations? And if you're not, do you have, relationship with your colleagues to be able to help those patients? And so that is very important. I mean, realistically, if anyone has the training and they put the time and the effort into it, anybody can do anything. It's just, knowing your limitations and then also making sure that you are comfortable with yourself and then always having that plan for when things don't go right. I think that's something that a lot of people don't think about.
So you were born in Humble, Texas.
Well, yeah, just like the T or the P is silent in Pterygoid, for in Humble, Texas, the H is silent. So if you say Humble, Texas, then we know that you're not from around these parts.
Well, my 4 of my 6 grandchildren live in Beeville, Texas. Yeah, that's kind of near you. Have you heard of Beeville?
I don't think I've been there myself in person. I definitely have heard of it.
Yeah, you go down 69 past Victoria, and it's down there on 59. Final question: you had one kid in dental school?
Yes, one kid during D2 year. I guess we had our first child.
So that means you're either Mormon or LDS.
No, we just got an early start. I got married.
The first non-Mormon who had a kid in dental school on Dentistry Uncensored. That's a title. The Mormons own that space, but you just wanted to get an early spot.
Yeah, so my wife and I actually got married in Vegas on the Strip on my 21st birthday, and we now been married 25 plus years, and so we had our first kid during dental school, who, believe it or not, has now graduated college and is now graduating nursing school and is, trying to go to school to become a CRNA. And my youngest daughter is also now out of the house and in college. So so we're empty nesters already at this point.
All right. Well, it only gets better because I guarantee you my 6 grandkids are better than my 4 kids. It only gets better. But again, you're busier than a one-armed dentist. Thank you so much for pulling over on the side of the road and talking to my homies for an hour. That was truly incredible. Thank you so much for all your time. And I hope to see you when you're in Phoenix.
I'll see if I can. I'll hit you up and see if we can get together.
All right, buddy.
And again, thank you for having me on the show. I appreciate it.
Oh, the honor is all ours. Everyone that got to listen to you. Thank you so much.
All right, man. Have a good one.